Hi, everybody. I'm Andrew Kuykendall.
And I'm Don McCulley. Welcome to This Stuff is Complicated. As you may have heard, we like to talk about music and musical t-shirts. There was a great Supreme Court opinion written years ago by a man named Byron Whizzer White who played football like myself. He played at a much higher level. Byron Whizzer White wrote, "I can't define pornography, but I know it when I see it. My friend here, the musician, knows and understands music." Andrew?
Thanks, Don. I'm not a musician. I'm a recovering tuba player. But it really helps. It soothes the soul. It gets me energized. It's something that has been a very, very big part of my life.
And I play music all day in my office.
Yeah,
I agree.
It's fantastic. It gets us away from some of the stress. One of the things that is creating stress for us, unfortunately, in the stop-loss universe right now is the crazy costs. I mean, things are getting expensive, and especially some of the drugs. This shirt, Billy Strings, I saw him in Tahoe, a 6,000-seat theater. It was absolutely incredible. He walks out and opens up with dust in a baggie. Now, we are not talking about recreational pharmaceuticals
and
here.
I'm guessing it refers to not an 8-ball on a pool table.
You are correct there, but it talks about how the cost of drugs has cost him his freedom and his life. There are some people that may have those same concerns today looking at the pharmacy industry. So we're going to talk about what's going on, where these costs are coming from, and what we can do to help abate some of that inflation. So let's start with the simple thing here. Medical inflation on whole dramatically outpaces standard inflation and certainly spending power. And that has become one of the biggest drivers of cost in our industry. When I was starting as a consultant 30 years ago now, my 25 years as a consultant, when we first started, 5 to 8% of average medical spend was spent in pharmacy. Now total spend is closer to 40, and some groups are even over 50%.
And healthcare is 20% of gross domestic product. It's trillions of dollars annually.
Yeah, and we are seeing, it's a good news, bad news thing, okay? We are seeing incredible advances in what can be accomplished with medication and with healthcare. You may or may not know, but there are now at least 7 confirmed individuals in the world that have been cured of HIV. Not controlled, not asymptomatic, absolutely cured because of advances in medicine.
So when we talk about Magic, not the Red Hot Chili Peppers version,
Yes.
but the NBA version, is he cured?
Not to my knowledge. He is controlled and has been for 30 years with the drug cocktail.
Hence the reason drugs might cost a lot of money, because they do solve things.
They absolutely do. And it improves quality of life and it improves quality of outcomes. That is incredible. That is great. Now, it is not just pharmacy that's really driving this. Medical expenses are far outpacing inflation as well. Do you know, Don, what the most expensive place to seek care is?
The hospital?
The emergency room in particular.
Oh.
The most expensive way you can get coverage is to be brought into the emergency room through an ambulance.
It's not just the automatic $1,000 you pay because your insurance carrier wants to penalize you?
No, they aren't penalizing. They're trying to use what they call steerage.
So the carrot and stick approach.
A little bit of a carrot and stick. Yeah, they want you to go to the urgent care first. But the reason an emergency room is so expensive is they don't know what's coming through that door. It could be a heart attack. It could be a hangnail.
So they're overstaffed from the get-go.
And they have to be prepared for everything. So that gets to something that we talk about all the time with our book of business, which is the site of service. Where do you go to get care?
My primary care physician first.
That's a great thing. And then he says, hey, I want you to get an MRI.
Well, that's what she says, yes.
And you have 2 choices. You can go to the hospital or you can go to the imaging center.
I don't know. Which one's cheaper?
Well, that information is not readily available to our average consumers. And that's a really frustrating thing. In general, I will tell you that the most expensive place to seek care is the emergency room. Second most, as you referenced, is going to be the hospital. A standalone imaging center is going to be less expensive.
Even if it's owned by the hospital?
Even if it's owned by the hospital.
All right. Well, that's where I wasn't sure because the hospital's been buying a lot of these places.
They have. And consolidation is everywhere. I mean...
And that's part of medical inflation also.
Back in the early 90s in Southern California, we had 9 HMO carriers. Now there's 2. Oof. Yeah. The business is evolving as we go. But one of the things I want people to remember is when you have the opportunity to direct your care, stay out of the hospital. For medical care in particular, you want to look at using urgent care facilities. You want to look at using your primary care physicians. You want to look at standalone service centers, imaging, dialysis, etc. There's going to be a lot of great opportunities there to save yourself and the plan money.
But when we're talking about pharmacy and we're talking about specialty pharmacy versus regular pharmacy, because specialty is perceived by me to be much more expensive, I'm getting it all at the Walgreens or the CVS for the most part, right? Or Costco, which is really the best place to get it.
Yeah, so this is an entirely different rabbit hole that we're just going to fly over the top of real briefly here, but we're going to dig into this quite a bit later on. We're talking about the cost of acquisition versus the distribution. Where you buy the drug is different than where it's delivered to you. So Walgreens doesn't always have 500 vials of Humira sitting in the back with your name on them already. They need to buy that drug from somewhere else. And depending upon who your pharmacy benefit manager, or PBM, is, they may be buying the drug in the United States or even importing that drug.
But if I recall, there was a 60 Minutes episode a few years back on, I think it was Rockford, Illinois, where they talked about pharmacy benefit manager, the name being oxymoronic. Do you remember this episode?
I do. Yeah, and it's, again, we're talking about consolidation. We have seen an incredible growth in the revenues and especially the profit of pharmacy benefit managers over the last 10 to 15 years. Coincidentally, similar growth in the use of specialty pharmacy medications.
And like you talk about bowl ads, when we go to medical conventions, what do we see? The number one advertiser is the pharmacy benefit managers.
Yep. There are two things going on in the United States. The United States is one of only 2 countries in the world that has PBMs that are allowed to advertise and pharmaceuticals that are allowed to directly advertise.
What's number 2?
New Zealand.
Oh.
And then the second one is, where are we getting our medications? We are getting them from the United States most often, but there are other countries in the world that produce at the same level with the same safety and the same protocols. So it's a good idea to work with a pharmacy benefit manager that you have confidence in, that is going to find you that best cost of care and the most effective care.
And those are hard questions to ask. What's the right cost of care? Because the contract's confusing.
It's very confusing. And that's why you want to start this process before you need to ask that question. As a good consultant, you will want to have multiple options available, interview these people, understand what their offerings are, and how it's going to impact your relationship, and most importantly, how it's going to affect the members of the plans that you're consulting on. So let's recap the 3 things that we want to remember when we're talking about the crazy costs of all this. Look for PBMs that are really focused on generic and specialty interventions. How are we sourcing the drugs? How are we driving lowest total cost at all times? When it comes to medical care, whenever possible, stay out of the hospital. That's where sick people need to be. If you have the opportunity to self-direct, look for urgent care, look for outside services. And then ultimately, look across your book of business, look across your Rolodex, find disease management and care management, leverage those vendor partners to help you drive the lowest costs. Thanks, everybody. We look forward to speaking with you soon.
It's appreciated. Have a great day.